Go ahead and call the meeting to order, please. As you may have seen in the emails, we've had a change of presentations today. Our first presentation today is going to be from the Retirement Board, and Joe Breiser, who's the current chair of the Retirement Board, and Nicholas Sapp, who's the vice chair of the Retirement Board, will be presenting first this morning. So turn it over to Joe Breiser. Thank you.
Morning, everybody. Thank you for being here. As you said, my name is Joe Breiser. I'm one of two county employees that are elected at large to the Retirement Board. I actually work with the Sheriff's Office and have been there for 26 years. And I currently serve as the chairman of the Retirement Board. Just for your own edification, in case you didn't hear, the reason I'm here this morning is, unfortunately, about 3 weeks ago, our executive director, Mr. Howard Miller, passed away from a sudden heart attack. So we'll get through this. I know Nicola's going to jump in on a couple things as well, as she's the vice chair and is also the other elected at-large employee on the Retirement Board. Just to give you a snapshot of our retirement plan, we have 3,869 plan participants. That includes the active employees, the retired employees, beneficiaries, those people whose spouse or significant other has passed away and they were an employee, but they're the beneficiary of their retirement income, and vested termination. And what vested termination is once you reach 5 years, you're vested with the retirement plan. If you leave and are not eligible to retire, you can, if you have at least 5 years, you can stay you can leave your money in the plan, and once you reach age 62, you're eligible to draw a check, or you can start drawing one at 55 under a reduced benefit of 3% per year, so 21% less at age 55. The entry-level employee that comes into employment in El Paso County is 37 years of age. The active employee currently working on an average is 45 and a half. And I remember years ago when I wasn't even close to that number. Now I exceed that number. And our average retiree's age is 67.8. The reason I put that in there is because actuarial tables for projecting the amount of money needed to pay a defined benefit plan is based upon a life expectancy that is used or determined using insurance mortality tables. And right now that roughly sits at 30 years. Women a little bit longer, men a little bit less, but the average is about 30 years, so that's why I included the age. And the average monthly benefit for a retiree is $1,322 a year, or excuse me, a month, which equates to about $15,000. Yeah, which equates to about $15,000 a year. And I wanted to put that in there. As someone who's been on the Retirement Board for 6 years now, I know there's a lot of scrutiny from the public as far as retirement, and they make it sound like it's this gravy train, but as you can see, that's not a significant amount of money that's being paid out to retirees. How do we get our funding? How is it that the retirement plan establishes itself and keeps itself? Well, over the life of a pension plan, it's really easy. The contributions and investment returns, so what an employee puts in, what the county puts in, plus what we make on our investments, should equal the benefits paid out to all retirees, excuse me, as well as the expenses it costs the plan to operate. Contributions right now are 7.5%. The county and employees both put in 7.5% of their pay. That comes up to roughly $16,089,000. Our investment return, I was talking to Ken before the meeting. We assume an 8% return. Unfortunately, that has not happened the last few years. I will let you know, since the life of the plan has met 8% since the retirement plan was first established and created back in the late 1960s. It has met that. Just as a way of an example, in 2008, when we had the catastrophic collapse, the market lost 28%. So we lost 36% because we didn't make that 8% we expected to make, and we obviously lost the 28% that the market took from the plan. Benefits, right now we are paying out $20 million in benefits to retirees, beneficiaries, and our expenses to manage and operate the plan are $527,000 a year. I would just preface that the retirement plan, the employees, there's three, are not county employees. Their benefits and everything mimic the county, but they are not county employees. But the retirement plan is part of the employees are part of the retirement plan.
I'd like to, if we could, roll back up to the assumed investment return at 8%. My guess is, with the PDPA restrictions that you have on investing public funds, that hasn't been met for 4 to 5 years and probably won't be met for the next 2 to 4 years. What are we trying to do at the county level to offset that reduction? I mean, a decade of low investment returns can seriously damage a plan of this type.
I'll get to the next slide. I'll show you some of the changes we made and how it's affected our actuarial tables. And there are other options we have as well. But suffice it to say, the one thing I will let you know is 2008 we had a significant loss. 2009 we actually made 11.8%, I believe it was. 2010 we made around 4.5%, and 2011 I don't recall what it was. I think we might have lost like 1%.
There is no parallel between requirements for El Paso County's funds invested in the retirement fund. The same statutory rules do not apply.
Correct. Correct. But obviously with that, with money coming in and expenses going out, we have a negative annual cash flow of $4.8 million. In other words, we are paying out of our, I don't want to say reserves, because the money we have, which right now is around $268 million, that money is earmarked. Out of that 268, that includes what I'm projected to get in my retirement, what Nicola's projected to get, what Ken is projected to get, Commissioner, if yours is in there, what you're projected to get. So that's all part of that. The numbers aren't that great, but this was an actuarial table in 2009 after the collapse of the 2008. As you can see, back then we had a member contribution of 6% and an employer contribution of 6%. The member rate, the 6% is the blue line, the employer was that. The yellow is what is an actuarial deficit, money we would be in the hole. I put that in there because this was projected out for 20 years. We have since moved it out to 30 years to mimic the mortality rates. But when I get to the 2012, some of the changes we make, there's lines that show just how much we've changed that. We still are operating with an actuarial deficit, and those are things that part of our presentation here today is to seek additional funding to the retirement to help shore that up. But I will let you know, for instance, in 2028, back in 2009, we had an actuarial deficit of about, or a liability of about $577 million. With some of the changes we've made, we've cut that by $250 million. So I'll show you the final chart. What are some of those changes that we've made? Effective January 1st, 2013, we're hoping for the annual increased contributions to go to 8%. Right now, in 2010, we went to 6.5, or excuse me, in 2009, we went to 6.5. 2010, we went to 7. No, back up. 2010, we went to 6.5. 2011, we went to 7. 2012, we went to 7.5. And the retirement board has requested that we go to 8% for 2013. That obviously has to have funding through the county commissioners to be approved. Minus that, we've reduced the yearly multiplier to 2% for all employees. Right now, for every year of employment, you get 2.22%. We reduced that to 2%. That will affect all employees going forward beginning January 1st of 2013. If somebody's been here for 10 years, they'll get 10 years at 2.22, and then if they work another 20 years, those 20 years will be at 2%. We increased vesting to 8 years from 5. Basically, that means you have to be here at least 8 years before you're entitled to a check, and if you decide to leave and have 8 years here, you have to have 8 years before you can be a vested, terminated employee. And we lowered the maximum payout to 60%. You can max out with 75% of your salary. If you're a county employee, that takes roughly 33 years and 8 months to attain. But right now we reduced that to 60 years. So at 2%, a new employee coming on January 1st would, if he worked 30 years, he would be maxed out at 60% of his salary. That's the most that any employee will be able to get. That's a new hire as of January 1st, 2013. Here's an actuarial snapshot of what we had coming into January 1st of 2012. As you can see, the blue again is the member rate reflecting the 7.5, and then it does project for 8%. This chart builds in the 8%. The member rate or the employer rate is green. The actuarial deficit is red. Some of the lines, that blue line there is what the rate of actuarial deficit was that I showed you on that previous chart in 2009. So you can see we brought that liability down significantly. The red bars should be touching that blue line had we not made any changes prior to today. The black line there is what we were holding for 2012. You brought up about the 8%. You can see because we were pretty much even last year, we're riding right along on that. We haven't impacted it negatively or positively. And then the purple line, the total rate there, is what we were at 2010. So again, there's some minor changes where the plan is done. It's helped decrease that liability that we have. That's the end of my slides. A couple other things I just wanted to mention. The only true way to affect the actuarial deficit or the unfunded liability that we do is either increase contributions or reduce benefits. We have reduced benefits, that 2.0. We have other options to consider. Obviously, they're not employee favorable. Right now, the county has a rule of 75, which means if your age and years of service equals 75, you can retire. That can be changed to a rule of 80 with a minimum age of 50. We could go to the rule of 85 with a minimum age of 55. For those of you who are familiar with PARA, another public pension plan, PARA has changed theirs incrementally, but right now if you're a new employee with PARA, you would come in with the rule of 85, minimum age of 55. And PARA is contemplating or looking at in 2017 going to the rule of 90 with a minimum age of 62 before you're eligible to retire. So yes, there are several other options there that the plan can take. This is our first step because the biggest way to defeat that actuarial liability is obviously make copious amounts of money in the market, and increase contributions are the two easiest ways to affect that. Yes, Kathy.
Is the county required to provide a pension plan as opposed to maybe over time converting it to a more of a 401k type retirement model where the employee can put as much, or usually with a cap, but put as much money as they want into a 401, and then their employer, the county, can put in matching funds up to a certain amount rather than having the county have to carry this entire pension, because more and more private industry, you don't get pensions. Here's a 401 that you can invest in. Here's a bunch of investments. It's up to you. You can put in as much or as little as you want, and the employer will match up to a certain percent.
Well, there's different aspects of a pension plan. When the county started the retirement, obviously I was knee-high to the curb and unaware of what precipitated that, but when you talk about pension plans, there's a defined benefit plan and a defined contribution plan. A defined benefit plan is what we currently have. You put in money, the county puts in money, it's invested, and you're projected a retirement check for your life expectancy. A defined contribution plan is what you were talking about. Contrary to what a lot of people think, that is a retirement plan, but what that is you put in money, the county matches it. Usually the county has some type of brokerage that would invest that for people. And when you retire, what your account balance is what your retirement money is. And you say, okay, I would like to take $500 out every month for the first 6 years, and then the next 20 years I want to take out $3,000 or whatever the case may be. The retirement plan we have right now set up in El Paso County, it is a requirement for people to participate in it. Social Security, we obviously also pay into that as well. When people talk about PARA, just as an example, PARA employees don't pay Social Security, and they put in about 15% of their pay into PARA. If we didn't have Social Security and that money was, them paying the Social Security and that money rolled into our pension plan, our employees would be paying in about 15% of their salary to a pension plan.
And I think to answer your question, Kathy, yes, I think it was in the 70s, is that right, Ken? That the county had to, the statewide counties had to opt to either go with PIRA or develop their own retirement plan. So to answer your question, yes, I do believe we are legally required to provide some type of retirement benefit plan, if you will. But like Joe is saying, how that is actually established and what that model is and how it's set up, I'm not sure how strictly that is actually legally defined, but I do know that we are legally required to provide that because we didn't go the PIRA route. Well, we actually already do have a 457 plan in place for the employees, but it currently it's just completely 100% employee funded. There's no employer funds that match that go into that, so it would be a complete restructuring. And like I said, I don't really know all the legalities. We'd have to get the attorneys involved into what we could and couldn't do as it relates to restructuring the plan. One of the things from a budget perspective I just wanted to talk to you about is when the commissioners went from 6% to 7.5%, they took the position at that time they would do 0.5% over 3 years, and you'll recall that. And they also took the position that they were going to not just fund the employer portion, but the employee portion, because during that time frame, you'll also recall, I think the employees only got one increase during that time frame, so they didn't want it to be effectively a reduction in net pay for the employees if they only funded the employer portion. To give you a sense of what the annual cost is to that, what you'll see coming forward when we look at the critical needs, I would say it's probably grown a little bit, so I would say 0.5% in terms of the county for the employer portion alone is probably right about $400,000 annually. And previously it was about 375, 380, and we'd have to look at, and that was of course with all the frozen FTEs and the eliminated FTEs we have, so we'd have to go back and review that. So that's why I'm thinking we're probably closer to 400,000 just with a minor increase. So if the commissioners were to fund the employer and employee portion, that would be 800,000 ongoing that they would fund. And how they do that is they effectively just give the employees a 0.5% increase to their pay at the beginning of the year, which offsets that additional 0.5% that would come out. It's not exact math, but it's close enough, if you will. So that's what will actually be, and we'll probably present those as two separate items, the first being the employer and the second being the employee, for us to rank through the process so that you understand how that works. And the reason why it's only 400,000 as well is because I'm talking about, of course, what we all look at here, which is the general fund obligation. The actual cost is quite a bit greater, but it's funded through restricted funds, grants, those type of things. So that's for us to look at those revenue streams and ensure that those available funds are in place. But most of those are either federal or state funded positions or grant funded positions. And so the amount that is just the general fund obligation, if you will, or under the general fund umbrella is about 400,000.
To answer your question? I guess just to expand upon it, the plan could go to a defined contribution. That would have to be a vote of the board. But to touch on the legalities of it, everyone who has, I'll use myself for an example, 26 years here, I would have to be cut off and have the option to take that as defined benefit and then start as a defined contribution. And then it gets into some tricky finances because now the $268 million that's there has to fund everybody who was just cut off on the defined benefit. And if that money runs out and there's people still living who haven't got their check, that has to be backfilled and funded. Because you can't dip into a defined contribution to offset defined benefit and hope. So it's a very tricky matter and has a lot of legalities to it. But the ultimate thing, yes, if the board decided that the retirement board decided they wanted to go to a defined contribution or offer it, it is something that could be done. Yes.
I had a couple of questions. I think I heard that the investments in the plan are not covered by PDPA investment guidelines. Is that correct? So
Yes.
you're free to
Yes.
invest in anything you want. And then you also, county employees also pay into Social Security. Is that, so we haven't used the defined benefit plan in lieu of Social Security. Both are actually being funded, which is one of the reasons for the lower payouts, because there is still Social Security there. And so there is no dollar for dollar offset in the benefit because of that, is that correct?
That's correct.
Okay, so it's subject to, what is it, 14.8, I think, thousand a year for Social Security. So as long as you're under that, there's no reduction in Social Security benefits. Okay, just wanted to clarify that. Thank you very much.
Any other questions? Okay. The one thing I did want to point out on this chart that was back up there, I forgot to mention that dotted line, just to show you some of the prior changes we had made. When we experience losses or gains in the plan, we have what's called a 5-year smoothing. So in other words, we are still recognizing, I'll take for example, and to just make it simple math, in 2008 we lost $100 million. We smooth that out over 5 years, which means we would recognize $20 million in losses every year. That black dotted line that's on there, the lowest one, that is what our actuarial deficit would be if we were not currently recognizing those losses from 2008. So again, I just wanted to say there have been sacrifices that the board has made that the employees have felt to, again, address that actuarial deficit.
And it's right where I put that cursor there. And I think that's key to understanding, I don't know how familiar everybody is with actuarials, but whatever information goes in and how it rolls out after 30 years. What Joe and I, we had I think a pretty lengthy discussion in May at the May retirement board meeting about, with the smoothing process in the 5 years, you can have a blip, but then you carry that, and what does that look like when that actually rolls off the actuarial projection, and how does that look moving forward, and what are really the resonating impacts? Because I always say from a finance perspective, an actuarial study is just that, an actuarial study. And so to the best we can, we want to meet all those projections and get where we want to. But anybody who's been familiar with using those, you know that the results can change dramatically, if you will, at the end, especially when you're looking at a full 30-year projection. And we actually saw some of that with what we projected the changes we're going to do when we looked at that in 2011 versus what actually happened when we saw the impacts of the 2011 market, which was not favorable. So based on what we did in 2011, do I have my years right? What we did in last fall, right? About a year ago. What was implemented about a year ago, based on those projections at the time, we thought would actually have a more positive impact than what it did. And so that's just based on what happened with the 2011 market. But then again, if that rolls out, and who knows how many years it's going to take for the market to actually really recover, and then 5 years from now, we could be looking at potentially quite a different picture. But we're not going to count on it, I guess.
I knew you'd have a question, Reb.
Are we going to get a hard copy of this, or is it going to be available online?
Yes, I thought we had hard copies. Okay. I'm sorry. Yeah, we'll get them to you. In fact, we'll probably run them here and get them to you.
Okay.
One very important thing to point out is that the county does not have a liability for the retirement plan as it exists today, unlike the state with the para plan.
Correct.
Follow up, so that we're not like some of those California locations. The county isn't liable.
No, there's no statutory provision for the county to provide a full funded, so that the county is not obligated or statutorily required to provide any type of additional funds to make it stable. It's changes that we have to make or request, meaning the retirement board.
And it actually gets a little sticky when you think about it, because the retirement board, we voted to go to 8%. But that's still got to go in front of the Board of County Commissioners to approve the funding. So you've got two different bodies here that don't, and obviously Joe works for the sheriff, but ultimately I work for the county commissioners, but I'm wearing a completely different hat, and so is Joe on the retirement board. So it gets a little sticky, if you will. The other 3 members on the board that we have is by statute. We've got the treasurer, which is Bob Balink, who's on the board, and we have Michael Pennica and Rebecca Ellis, and those are 2 board-appointed private citizens that have expertise with retirement plans and in the financial world. So,
And then there's 5 employers that are part of it. It's the county, the district attorney's office, the retirement plan itself, the health department, and Pikes Peak Library District.
and those are ex officios.
2 quick questions, just informational. Who is it now that manages the investments of the plans? I guess the board manages the investment, but who actually handles the funds and the assets that are in the plan?
Watershed Investments up in Greenwood Village. A gentleman by the name of Dale Connors is our investment advisor.
And
how
Mr.
often-
Miller was very active as well before
Yes.
his
sorry?
sudden death. Mr. Miller was very active as well before his sudden death. He watched everything on a daily basis and provide.
And does the investment relationship for the plan come up on an RFP on a regular basis, or how long has it been with Watershed?
Actually, the retirement board is not subject to the same RFP or procurement legal requirements, if you will, as the county. And I wasn't here when Watershed was chosen. So,
Yeah, Watershed came on in 2006 or 7. They switched and went with Watershed, and it was before my time. I came on like a year after they started, and I don't know who the previous, Ken might know who the previous one was, but
Tough time to come on board.
yeah. Well, that's what I said. I got elected in 07, and 08 everything tanked. I was like, well, this doesn't bode well for career advancement. All right. Well, thank you for your time, and hopefully your positive recommendation. Yes, Reb, nothing about the Packers.
I'm sorry, about who? He's talking about
I was expecting
I
I
know.
was expecting a parting shot from you before I left.
No.
I did the same thing.
Nicola, we will be reviewing and making recommendations on 2 things then. One, that the commissioners want the employee to go to 8%, and they are going to go to 8% simultaneously, or are those 2 issues, one for the employee and one for the county?
Legally, what the statutes surrounding the retirement plan say that there has to be a 50-50 split. So if we go to 8%, it has to be both on the employer and the employee side. What the question will be, Reb, is will the commissioners fund both the employer and the employee, or just the employer portion, which means then the employees would actually have to, if there were no pay increases associated with it for this next year, then effectively it would be a reduction in net pay because they'd have an extra 0.5% come out of their check to go to the retirement plan if they were to fund it themselves. If the commissioners were to fund the employee portion, we'd effectively give everybody a 0.5% increase like we've done the last 3 years. That way it would have a negative, a net, a 0 net impact, if you will, to their pay. So so we'll be talking about the funding. Either way, if we go to 8%, we both have to go to 8%. It has to be a 50-50 match.
Whether or not we increase pay to the employees to cover their costs.
That's correct. To reiterate what Mr. Turner said, the county would be on the hook for the employee portion. Whether or not they choose to do the employee portion is secondary, if you will.
It takes 8 years to vest.
Now it
As of
No.
January 1st, 2013.
With term limits, there's no incentive for the commissioners to support the retirement.
Actually, I think we did have support from some of the commissioners and elected offices. That would actually require them, though, to be
2 terms.
2 terms. Thank you. To be elected for 2 terms. So if you have a 1-term commissioner, they would not be vested. And that's actually part of the reason why we went to 8 years versus 10 years.
But 8 years, they can still be vested at the end,
Yes.
even though they're only two.
Correct.
That's
Yes.
correct.
It's minor, but it just.
Yes.
Yes, but
Yeah.
but it did play a role because currently with some of those term limits, you've got not just the commissioners but other elected offices that legally could only serve 2 terms, And so at 8 years, so that's why we went to 8 versus the 10, because pretty much anybody who was, limited to 2 terms wouldn't be able to
Yeah,
be
we
fully
we
vested.
discussed 10, 12, and 20-year vesting, because there were a lot of people felt like, it should be a long-term employee only who gets a retirement check. But obviously, your exact point is something the board realizes if they can't get one, it may not be in their best interest to fund anything.
And the other big piece of that discussion as well is we all know here that we tend to serve as a training ground. The sheriff's office, the district attorney's office, we tend to serve as a training ground for those folks to get their expertise, to get their experience, and then they go elsewhere where they can make more money. So the 8 years also allowed us to do that, so that those employees either could stay longer to be fully vested, or they wouldn't be vested if they just came and utilized the county, if you will, as a training ground. And we've talked about that. The cost to replace and train an employee is about 50% of their annual salary every time you have a turnover. So let's say you have an employee that's paid $50,000. And that employee terminates, it's going to cost you about $25,000 to train and get somebody else into that position and up and running to the level that previous employee was. So that's a real cost to the county, and also to the retirement plan. And so that was part of the discussion as well.
All right, thank you.
Thank you very much. Do we need 5 minutes? Patrick says we're going to take a 5-minute break. And then we'll have Jill Law from the Public Health Department.
All right, we're ready to proceed with our next presentation. I'd like to introduce Jill Law, who's the Director of Public Health for the county.
Good morning. Again, my name is Jill Law, and I am the Public Health Director for El Paso County Public Health. A very new appointment. I was just appointed officially last week, but I have worked for your local health department for 17 years. I'm also a registered nurse, and I've been serving as the interim director since March the 11th. And so what I'm here to present to you today are some of the upcoming funding challenges that we have for 2013. And we did put some documents out there for you, and we can go through the PowerPoint, as well as I'd like to really talk briefly about what our overall budget is and the departments that I'm featuring, how they fit into not only the health department's strategic plan, but that also dovetails into the county's strategic plan. And so essentially, I'm really going to focus on 3 departments today that are departments which we are mandated to provide services for, but our challenge is such that some of them, we receive no funding to deliver those services. Other challenges in state statute, we can only charge a certain percentage to recoup costs of those services. And so it leaves us in a situation, like many departments, where you're required to deliver services, but you're not able to be fully funded to do that. I'm not really going to go back in the past and talk about different cuts that we've been through, because I don't know any departments that haven't had to live through that. I think not only departments, but people in their personal budgets have had to experience that. I would like to give you just an example, though, so you can understand what has happened over time. When I started in 1995, we had 250 FTE for the health department, and we now have about 171. So it will give you a little bit of a description over time with budget changes and cutbacks, how we've made definite decisions to reduce in other areas to prioritize what we consider critical departments. And that's really what I'm going to talk about today. One of the documents that you have that I think will give you a little bit of history and some of the work that we do is it's our annual report. And just so you know, this is a report that we put out every April. It's not only a report that we've been committed to putting out, but as we move towards becoming an accredited health department, we are required to put a report out to the community. At the very bottom of the back page, you're going to see what our annual budget is. For 2013, it's only slightly higher. We're looking at about $15.5 million as the budget for 2013. In that budget, 67% of that is funded by either contracts, fees, or grants. And then about $4 million of that is by county dollars or what's called state per capita dollars. So that's really the most flexible money we have. Those other contracts, fees, and grants are very specific to the departments that receive those to deliver those specific services. And I think an important caveat is, for example, we do receive a large grant to deliver WIC services, which is Women's, Infants, and Children, for food vouchers. I can't take that money to fund these departments that I'm going to be talking about today. So I think that's important information, that many of the grants, fees, and contracts are very specific to those services being delivered. Also, just for your reading pleasure and not necessarily for today, we did put our health indicator report out there for you to read, and that is really just an assessment of the community and where we stand in overall health in the community. And certainly some of the departments I'm talking about today feed back into what we discovered in that annual report. Again, that's also very important for us as we move towards our accreditation process, and we are hoping to be the first health department in the state of Colorado to be an accredited health department. So overall, that's what our goal is when we wrote our own strategic plan, as well as we helped work with the county on their strategic plan. The departments that I'm going to be referencing feed back into the county's strategic plan, and really if you have a chance to look at that and review it, it'd be page 18 of the county's strategic plan, and we are section B. And in that strategic plan, it's to protect citizens from foodborne illness by utilizing community outreach and partnerships to promote food safety, ensuring that retail food establishments achieve compliance with food safety. That's very specific to one of the departments that I'm going to be presenting to you today. Do you want me to? Okay. All right. So if we really go and look at the 2013 funding concerns, the three departments that we're going to be talking about are the Communicable Disease Program, our Tuberculosis Program, and our Retail Food Safety Program. These are three different departments that we have within the agency that are very unique to a health department. These are not services duplicated by other departments within the county or any other private sector, and these are departments that we are mandated to provide these specific services to the county. And we're going to first talk about communicable disease. Our communicable disease program is a program where, obviously, essentially, it's the detection, investigation, and initially finding contacts for specific diseases, and making sure that if those are treatable diseases, that we can either get them in or find some way to get the population served. One of the things that you probably have heard or read about in the paper is the country is experiencing one of the highest pertussis outbreaks in 50 years. And so that is definitely one of those diseases that we look at. We're fortunate right now in El Paso County that our pertussis rates have not shown a drastic increase, but of course statewide we've seen that, and so we're watching that very closely. But for example, when you have an outbreak of that nature, there's what's called a contact investigation that we do to locate anyone that might have been potentially exposed and make sure that they can get into treatment. Because ultimately the goal is, because where it becomes very, very serious and life-threatening, is when pertussis is an under 1-year-old or an infant, if you will, is exposed. And so certainly we have lots and lots of work to do. We've worked on, in the 17 years that I've worked there, we've worked on hepatitis A outbreaks, that's a foodborne outbreak. We've worked on meningococcal, that's an airborne, that's a respiratory. I've worked tuberculosis outbreaks. I've worked outbreaks related to Giardia, again, a foodborne. So again, there's almost 60 reportable communicable diseases that any given time we could have to deal with and respond to. And the communicable disease program, the expense of that program, just so you know, is $300, and this is for 2013, so I base the numbers strictly on 2013. And the budget for that department is $365,839. We are not allowed to collect any grants, fees, or contracts for this specific department. This is a state-mandated service, and counties essentially just have to figure out how to absorb the cost and deliver the service.
Has this been funded by the county in the past?
Essentially what happens is the county dollars and the state per capita dollars are our flexible spending. So the answer to your question is yes, some of the county dollars probably have, but we've also had to use the state per capita money as well. I really just, wanted to demonstrate the departments that we have no ability to collect money any other way. And so when I say deficit, ultimately it's to the department, but do we have other ways that we can backfill? One being we not only do we have county and state dollars, but we also then, for the grants, contracts, and fees, we have a certain level of indirect that we charge. But the flexible dollars are spread across many different services. I just wanted to feature today really the ones that are mandated.
So this isn't technically a deficit or a new expense to the department.
Correct.
This is an expense that has been ongoing and has been funded.
Correct.
Through your
correct.
budget process.
And deficit might have been. I'm a nurse. I'm not a financial person, so deficit might have not been the best word. Essentially, what I wanted to point out was a department that I have no way to get any kind of grant or contract funding. That's really the ultimate goal. It's a service we have to provide that ultimately we have to figure out how to make that funding happen. I think that's a great question. So this is one of the departments that's unique to itself. The two other departments I'll feature, we do have some contracts, we do have some fee scales, but you'll find that it doesn't cover everything. So now we're going to move on to our tuberculosis program. This is our program, again, another mandated service. And I also need to point out, Senate Bill 194 was really brought to the forefront about 1.5 years ago for public health. So not only were there already some statutes in place, or mandates, if you will, of services that were required, but then the state of Colorado and the Colorado Department of Public Health made an official statement of what they call core services that need to be offered. And these three departments are core services. services that should be delivered. Not only are they obviously mandated, but now it's called out as a service that a health department that's providing the proper level of service should have. The tuberculosis program is the program where we see and treat and medicate those that have active tuberculosis. And so that is a disease that I think we all thought at one point didn't exist anymore. The disease rates are down. However, we still will get cases. Just as an example, this year we've already seen and treated 10 active cases. That may not sound like a lot, but when you initially get them started, you see them 3 times a week, and we go to their home to make sure that they take their medicine. So if you have 10 new cases at the same time, it is an extensive amount of work. And the amount of time that we provide services could be 6 to 9 months based on what their doctor's recommendation or the physicians that oversee what they would want us to provide that patient. So again, that particular department, the actual overall budget for 2013 is $204,694. We do receive fees and contracts, which get us close to almost $140,000. So what we don't have then, and certainly let's use a different word than deficit, but the remaining amount of monies that we have to figure out where to pull resources from is $65,414. This is a department that we've made reductions to as a way to try to curb this. And so essentially, very recently we moved from 2012 to 2013, reducing this department by half of an FTE. So it's an area where we are very much trying to figure out how to still provide the services, but these are not services provided by our entry-level staff. These are registered nurses, and we also have a contract physician as well as our medical director. So there is a level of professional and educational expertise that's required to provide services in a department like this.
With tuberculosis being as serious as it could be, I mean, we have a control on it, is what I understand, as a disease. However, if you don't pay any attention to it, all of a sudden we'll have a massive outbreak.
You know, well, and here's the concerning piece. We're actually seeing a little pocket of in the southeast part of the United States where it seems to be rearing its head again. And all it really takes is people to relocate, travel, and I mean, I love to go to the southeast part of the United States. And so with that being said, Colorado, our rates have reduced. However, we said that 5 years ago or 6 years ago with whooping cough, and look where we're at now. And so the reality is there's always that potential. I have worked just even in the past 5 years, we've had contact investigations at an elementary school. We have had contact investigations at a college, and most recently in the entertainment industry. The positivity rates at the elementary school, we did have 2 schools we had to work with. You know, we certainly did have cases out of there where we had to do treatment, and it's called latent treatment, meaning they weren't infectious, but we give medicine to prevent them from getting there. And so there's extra work to be involved even if there's not a person with active TB. The person that's exposed needs a certain amount of treatment as well. So.
If I understand it correctly, the primary expense of the program is in personnel costs.
Absolutely.
The medications are quite often covered by a person's insurance or Medicare or Medicaid, but having to actually put investigators on the ground to track the source of the outbreak, to monitor the compliance with their medical requirements for a person that has been exposed to TB, and that's where most of the expense is.
Absolutely.
Okay,
and unfortunately, many times the individual that we're working with actually doesn't have insurance or prescription coverage. We receive medications through the state of Colorado. It's called the apothecary that provides us the medications. So that is not a cost to us. We are provided those. But essentially, it's registered nurses, obviously, that go out in the field to make sure that those individuals do take their medicine. And the majority of our patients are very compliant, but they also are working, and they can't always just come to the health department. And best practice for an infectious TB patient is to take the medicine to them. And that's a national best practice. That's not just unique to us. Great. Just stop me if I'm giving you too much information. Okay, and then another one of our services, again, that ties directly back into all of the strategic plan for the agency as well as the county, is our retail food safety program. And I think in a nutshell, this is the program where when restaurants have inspectors by the health department, this is it. And this particular department, we have approximately 2,400 licensed food service establishments, and they receive inspections 2 times a year. And so in 2 times a year, they're going in and they're providing not only inspections to proper sanitation, proper food practices, they're providing education to those employees that work in those restaurants, as well as they may be going into that restaurant because there has been a complaint of a foodborne illness. And so there are several reasons why our environmental health department and our inspectors may be involved in assuring the safety of the public by inspecting the retail food establishments. This could be a restaurant, it could be a food cart that you see at your local fair, and it could be the schools, the cafeterias at the schools. So there's many varieties to what a retail food establishment is. It could be a grocery store, it could be your corner market. And so again, with 2,400 and doing that twice a year, it's a big job. That particular department, there are state statutes that only allow us to collect a certain amount of fees. And so again, this being another area where for public safety, it's absolutely necessary. It is a mandated service. It's a core public health function, so of course we love providing the service and we believe in it. Unfortunately, there's statutes written that we can only collect a certain amount of money. That department is obviously $1.1 million. The remaining monies that we can't collect on fees and licenses is a little over $500,000. And so our fee structure in El Paso County, and actually statewide, is written differently than what you would find in parts of the Denver metro area. So this is a very unique ongoing dialogue across the state by public health directors and by environmental health directors. The amount of fees really and we're low, and about 46% is what we can recoup really. And that's as much as we can charge. And so this is an area that is an ongoing challenge for us as well.
Please forgive me if my numbers are wrong, but my recollection is that last time we had a presentation, we were told that there was a delay, that we were, for lack of a better term, behind schedule in inspecting the restaurants. I seem to recall the number 2.5 years, 2 years, somewhere in there. Are we closing that gap? Does that sound correct, or am I misremembering?
Well, the gap has been closed, and we have a new. Well, actually, he's been with us. He's not really new, but Tom Gonzalez, who's actually here, he's our environmental health director. He has worked extremely hard with our team to get us back into what we call a compliance mode, which is offering those every 2-year inspections, or what's separate is if it's a complaint. So that could be an extra, but. We really just had to come to the resolve that best practice is getting in there irregardless of how we figure out how to fund it, because it's a public safety issue. So we prioritized in that department. We maybe scaled back in other areas to make sure that this was a priority, because if you think about the sheer numbers of people, I don't know about you, I'm a terrible cook. I eat out constantly. And so the benefit of having those restaurants inspected and sanitary, and those food workers understanding the importance of good sanitation and food preparation affects everyone, because we're a society that really, we eat out. And that was a priority. Yes, sir. The food carts are kind of a caveat in the fact that they don't necessarily always operate 12 months out of the year. So it could be right before they're going to be working at a fair or a street event, or otherwise, if they do, say for example, I'm thinking of maybe one of the food carts that's always parked at like one of the hardware stores, then they would be twice a year. But again, that's kind of a industry that isn't always year round, and so they still fall under the 2 times a year rule, assuming that they're working 12 months of the year. I'm sorry? well, you know what? Many of them come to us. So with that being said, your regulars that are open year round, they actually, that's why it's kind of funny sometimes if you see the health department parking lot and people wonder why there's a food service cart. Well, they're there because they're mobile. And so essentially sometimes in order to benefit them, we have them, bring this to us so we can help get them going. But we also go visit your street fairs and your county fairs, and the men and women that work in that department are all over this county every single day. Yes.
So what are the strains on the overall budget with $900 and some thousand having to be met out of the El Paso, out of your total budget? What are the strains that it places on the rest of the, by not having, in other words, you're taking that $936,000 out of your budget somewhere.
Well, it ultimately makes other departments essentially have to live extremely lean. They may not have the opportunity to have the newest equipment or the latest technology. We may not be able to do certain educational things that we had hoped we could provide staff. There's just a caveat. It's really based on also the times and the trends as to what ultimately gets affected the most. I think probably the broadest thing I can say, though, is we really are a very small operation by way of the amount of employees we have to the county the size that we are. And so essentially there is always some potential unintended consequence when you're reducing an FTE in a department just so you can also help offset and balance other areas that you have to deliver those services. It's not always the best position to be in, but money's money and it only goes so far. And so that's where we're at. And again, you just have to hear this. It's just a observation, but 250 employees in 95 and 171 now. It's a very different world that we operate in. There's no extras.
I'll start by saying you guys have an amazing job that you have to provide. You do a wonderful job for the county, and that's really shown by the fact that we don't see big headlines of massive outbreaks of things in El Paso County, and that's due to a large extent to the efforts that your department does. So thank you very much for the work that you do. My question goes back to a question I've asked in prior sessions, and that's on the licensing and fees that we're able to charge to food service providers. And as it comes up that is mandated, I'm trying to understand how those fees are set. Is there an assumption at the state level that the fees that are allowed to be charged should cover the entire cost? Is there an assumption that it should be subsidized from other places? And what are we doing to try to increase those fees and licensing costs to cover the cost of what it actually takes to manage the program?
And first, let me say it's based on the type of retail food establishment first. So all things are not necessarily equal when you're looking at, is it a restaurant that can have 400 people or 15 people? So there are some different categories, if you will. And then the fee structure is somewhat complex that I'm happy to send out and share. I did not bring that with me today, but that breaks down what the fee structure is. And then we can certainly give you some history on some of the maybe political dialogue that has occurred related to that issue, because it has been an ongoing dialogue from counties outside of just El Paso County as to how and why is it that we're not able to, and when we say recoup costs, if we could even get to 70 or 75%, that would be of great benefit. But the structure has just not progressively moved forward to have that dialogue to allow us to do that. It's for 5 years I've heard this discussion.
And I think, and I just want to say, and this is just as much for Jill as this committee and those of you who've been here, know that the recommendations that can come out of this committee are not just strictly financial and related to the critical needs. This can be a general recommendation from this board to actually look at statutorily taking forward a House bill something at the state level in the next session to look at this. We know that El Paso County has been aggressive in that area with several other departments and revenue and that type of thing with the Department of Revenue. We've been very aggressive. Our commissioners have led the charge in that, and also we've got several state representatives that have backed us with the several measures that we've moved forward with. So that is certainly something that you can put down as a general recommendation in addition to the rankings, because we always provide those, as you know, in addition to the county commissioners.
Is there a fine structure in place? So if your department goes in, inspects a food establishment, they don't receive an A rating, they're cited for specific issues, are they assessed fines?
There are, and it's specific to if the assessments are made and there's still lack of compliance. Okay. There are layers of fines.
The first gets a warning, the second gets a fine, the third gets a bigger fine?
Well, we don't tend to go to fine that rapidly, but with that being said, we're very fortunate that we have high success rates, I think because of the good relationships our environmentalists really have locally, to get people to come into compliance and want to come into compliance. Because remember, these are online inspections now. You can actually go out and look these up. There's definitely some potential business damage if you don't come into compliance. And so there's a lot of dialogue that goes into that and a lot of visits that are made, especially if it's a critical violation. Can fines be levied? Yes, they can. Yeah. If people, yeah, and again, under the auspices that you choose to go out and educate yourself and take a look at where you're wanting to eat, I will say that absolutely. And we've had that online, and I think we launched it at the beginning of the year, but don't quote me on that. But yeah, it's online. I go out and look at it myself. I mean, it's very valuable information. It will also tell you how rapidly we were able to work with them to get them to come into compliance. And the nice piece is many times, you may see a next day appointment by us, you may see within that week. It depends on what the issue is. Of course, anything related to sanitation by way of, water, all that's very critical for us. So, but yeah, can fines be levied? They can. We hope to not have to go there, but it's always a possibility. Sure. Sure. But again, that would be only those that are not compliant, really. Yeah. Yes, ma'am.
Of the top 10 Front Range counties, are there any that completely fund their retail food safety with the...
I believe Denver County. Tom, do you have a memory of what county might be fully funded by way of what fees they can charge?
And what I'm hearing is that gap is not specific to this county. It's pretty much statewide with the exception of the home rule Denver.
Correct.
And that the deficit is the same. We're just reiterating for the recording.
And that's correct. Like Tri-County Health Department, we got their numbers at Douglas and Adams. They are recruiting costs at 47%. We're at about 52%. So, and Boulder was about 45%.
So everybody's around 45 to 50%, if you will.
And I think the unfortunate side effect or the unintended consequence to this can be departments having to decide whether you can inspect as frequently as necessary. We've made that a commitment and a dedication because we know how critical it is to prevent foodborne outbreak and the safety of the public. But I will say that I know from other public health directors, it is a dialogue of if you can only recoup about half, can you really meet those 2 times a year? And that's certainly a dialogue that is what I call the unintended consequence to this issue. Yes, sir.
This question is more general and it might take both of you to answer. It appears that your 2011 budget from total revenues, I guess, included approximately $3 million from the county. And you're asking or suggesting that you're going to be approximately $1 million short. In other words, approximately 33%. That you're having to steal from 33% of your budget is going to have to be taken from that $3 million.
So I'm going to clarify that for you. So, and let me know if I say anything that's not. What Jill is showing you right now is the portion of is the portion of the budget that she is effectively an unfunded mandate. So she would be taking the $900,000 from not just that $3 million, but also from the state per capita.
Correct.
The state per capita dollars. So just to give you, and this was kind of a general statement that I was going to say at the end, is that we are in the process right now of consolidating the budget and finance functions of the health department under my department. And so what's going to occur during that process is we're working closely with them to review all the historical and all the budget and financial aspects and getting everything transitioned, the bulk of which will get transitioned at the first of the year, because that's always, you always want to do that type of transition at the first of the year. But based on that and what we're looking at, when it comes time for you to do your deliberations and look at your actual critical needs, we will have outlined something different than what you're seeing here. And so, and that's something that's a process that we are still working through. So what Jill is trying to provide you with is an overview of just the projects that are mandated and unfunded mandates, if you will, and then the other presentation related to the critical needs, if you will, that'll speak to where we're really trying to make up. And we'll go through how those dollars, the 3 million county dollars, if you will, support, and then the per capita dollars, how those are allocated and spent. So you will receive additional information as it relates to the health department. But Jill was kind enough to step in today with the cancellation of the.
Oh, that's, I think we have to go back to the word, the deficit was probably an error on our part when we used that term. Again, please remember I'm a registered nurse, so I'm not a financial expert. I think I mainly wanted you to hear that this is a challenge area. It will be an ongoing challenge area, considering we're in a position where we have to provide the service, but we don't have any ability to fully fund it without those resources from county or state per capita. And I will tell you, at least we were funded this year for state per capita. That is a moving target, and that has been a moving target. And so we pretty much hold our breath every July, and we found that we got flat funding again, essentially, which was good. But that's really the pocket of what I call flexible money. But that line item has, I'm trying to remember what year it was. There was a year where we had a significant reduction of state per capita.
And effectively, once what we'll see, I'm looking for the microphone, I've got 3 or 4 people queued up here, but effectively what we'll see is by the health department having to fund these unfunded mandates, and though this $1 million being taken away from those other funds, then where does it short those other programs as well? That's ultimately what how I anticipate this will proceed.
So for clarification, the 900,000 is included in the 3 million figure.
A portion of it would be, and then a portion would be in the state per capita. So we'll give you the overall budget. Okay. It'll get a little sticky, but but what we'll do is we'll outline for you, this is the total health department budget. These are the pieces that can legally be spent for these purposes, much like what we'll do with DHS. And then these are the pieces that you have discretion within. And then these are the pieces that Board of County Commissioners, and when I say the pieces you'll have discretion within, that is the directors for the Board of Health, and then ultimately what do the Board of County Commissioners have discretion within, which is where your recommendations come into play. It's understanding how we tier. It's the same thing with the Department of Human Services. It gets a little bit more complex, but we'll outline all the pieces for you and what's relevant for you.
I think maybe where I could give you a little bit of a concrete example of why this poses a challenge to us. This particular past year was the first year that we have seen a reduction in our women's, infants, and children's contract from USDA, and it's our WIC program. We have about 16,000 clients that we serve and provide food vouchers. At the time, we had 4 locations. We received notification of a $273,000 cut via the feds to the state to us. The more we chip into those flexible dollars, the less then I can ride through cuts to a department like that. And so essentially, I have educators that normally would have a caseload of about 500. Some are carrying 683 caseload because I now can't afford to pull flexible money to put into that department to hire more educators. So that's where this balance becomes quite a challenge, and I probably didn't do necessarily the best job explaining that in the beginning, but there are other departments that we consider very necessary. It may not be necessarily considered a core public health function by statute, but certainly getting food vouchers out to pregnant women, infants, and children up to age 5 is a priority for us. And so my educators are at a point where their schedules are so full, to get people in a timely fashion is a real concern for us. So that's kind of an example.
And those are the types of things that we'll discuss.
And there will be an overall request for an increase in budget for the department?
I anticipate, yes.
Two pieces. One, to the issue that you just mentioned over WIC, it strikes me as interesting that the federal government that seems to be doing everything that they can to increase the people that are needing to have WIC funding and assistance is exactly the same administration that's reducing the funds available to the states to actually provide the program. I still haven't quite gotten my head around that. I must be missing something, but
Well, actually, I don't think you are. One of the challenges that came down with USDA, the actual funding for the food voucher side of the program did not reduce. So the funding for the same level of food commodity, if you will, stayed the same, but the money to provide the staff to give the voucher went down, and that's a huge challenge.
doesn't make any sense to me. You have to be able to provide the funds if you're going to increase the roles. But the other question was more to some changes from the last time we met, as we were talking about buildings and facilities that were excessive in cost, that really we should run a bulldozer over, and apparently we figured out a way to do that. Now that you've moved into the CSC, how has that impacted the budget? There were excessive costs associated with maintaining the other building, and that was being borne by other areas of the county.
Well,
and now that you've moved in, how has that impacted your budget?
Well, our work isn't done yet, so let me tell you what's happened since we have moved in the building, which was just October the 1st. So essentially, the work that we've done so far is not only are we talking about the infrastructure, meaning the building, but we did then wrap our IT department into the county ID department. So we were looking at consolidating to save monies there, as well as we're now working on that with Nicola and her group through finance. The fires slowed us down a little bit. I mean, we've had a couple things that have hit us since we started this process. So I don't know that I have had enough time yet to be able to tell you what kind of cost savings that would look like, because again, we just got here October the 1st, and we don't have these departments completely merged yet. I'm hopeful that we can have some decent projections, and by the beginning of the year have a little better understanding, but we're right in the middle of that process right now. But I will tell you, we are completely pleased to have a building that has regular water supply. The electricity stays on. It's not 120 degrees in people's offices. It's not 58 degrees in the winter in some people's offices. So it's been amazing to be, and it's also wonderful to be with the other departments. Many of our clients are the same as like the Department of Human Services, and so it really helps the public to really come to one location. So we have absolutely no argument with being in a building that has, I mean, we closed the building 3 times the last year for water breaks. And that's a real problem when you're trying to get vouchers out to families and you're trying to serve the public. And so it's been a Sure. Sure, and I'm not privy to like what utility costs are. That's all out of their department. So those are things that again, that comes out of a different department. But
And we can certainly have a separate discussion just on the costs associated with CSC and the strategic moves. Some of it we can address in terms of the Citizen Service Center, but some of the other costs associated with the other facilities until all that construction is done, we're hoping to get the coroner in by somewhere around May of next year. We won't be complete with all of that, and at that time then we'll do a building assessment. I think really what you're going to see is your, from an operational perspective, and I'm just talking big picture here, I think from an operational perspective what you're going to see is instead of doing one-time, taking that money, instead of doing one-time fixes and Band-Aids, you're actually investing that money into the operations of a new facility. I think where you're going to see the greatest financial impact, of course, is with the capital needs that we've already seen once that reassessment and master plan is updated by Mr. Gore. I think that's where you'll really see it. I think where you'll see savings as well on the health department side is going to be through the consolidation efforts of those departments, much like what we did with the Department of Human Services, where Mr. Bankston now just focuses on the programs itself, and then Ms. Law will be able to focus on the programs themselves without worrying about the HR, the IT, the finance piece, and all those other components.
I do think one area that I can absolutely speak to since we've been in the building, one of the benefits of being in an updated facility that has proper infrastructure is it does help your staff be more efficient. I used to oversee, before I became the public health director, I was the division director of all the health services, which was all the clinics. I had 5 waiting rooms, 5 check-in stations, 5 checkout stations. Staffing that on a regular basis is a challenge in itself. We now have 1 consolidated waiting room, so at any given time, if a department's short, we're able to now start cross-training employees so they can go help out their partner department because we can all see everything. And so that's kind of a concrete example of what being in an updated facility can do. We had 3 floors with 5 different areas, and we now have a security guard that can help watch all of that. I mean, it was a tremendous undertaking to keep that. There's just, that building was, it had its own, I don't know, it had its own brain or something. But with that being said, it was a challenge. It was an absolute challenge. And so this has been such a nice change. And it does help the staff, I believe, be more efficient. You know, you can't cover 3 floors in 5 different areas and feel that efficient. I think they're very pleased with it, too. Yes, sir.
The other side of that strategic moves project that we've been inquiring about is any identified challenges or foreseen challenges that may result from the move. There anything new that has arisen or that you see might arise as a result of changing locations or consolidating that might impact your budgetary needs in the future?
You know, not that I don't think we're addressing. We have a tenants committee where the directors of the department, we come together and we look at maybe challenges that the public have reported or that the staff have reported. And so far, I think we've really been able to accommodate, for example, working on, you know, where the bus, you know, drops off the public, and the sheer nature of the size of the building and finding ways to help people get in and out efficiently. So I'm not hearing, and again, there's been some question about drop in our WIC department. We had to close 2 satellites to deal with the budget cuts, and our caseload has dropped very minimally, maybe by 300. That's not unique to this time of year anyways. So at this point, I don't see any real blaring data that really ties back to that. And again, as we do talk about it in the tenants meeting, we're actively finding ways to implement a new strategy and fix that.
And really, it's been minor things like, do we have enough wheelchairs up front if you've got elderly people coming in that need to be, you know, wheeled around and navigated down those long corridors because it is such a massive building. DHS on the 3rd floor with 500 employees up there don't have enough bathrooms, and so compared to the other floors, because there are employee and you know, and public bathrooms. You know, these are the types of things, if you were to look at our agendas, it's actually quite comical, the types of things that we are discussing. The bus issue, I would say, was the biggest, only significant issue, in that the bus was stopping at the top of the hill, and you're watching elderly or mothers with strollers, especially in the cold and ice, trying to navigate down that hill, which is quite daunting,
individuals in
and a
wheelchairs.
safety issue. Yes,
Yeah.
was a safety issue. So we've been working that from both the political level and with the bus service provider to get that addressed. But it's really just been minor things along that nature, if you will.
I think one more positive, it's brought departments together that historically have been throughout the city that didn't really get a chance to work as closely. And it's so nice now as we have issues emerge. For example, I'm working with Department of Human Services and one of their managers to look at ways. So for example, when when a woman comes in and is getting a pregnancy test from us, and let's say, for example, yes, you are pregnant, all the different stops we can put her in that building to get things set up and in place for her before she ever leaves. Those are things we probably didn't do as well in the past because we didn't live together, and we do now, and so we see each other every day, and so we can stop each other and say, hey, this is something I think we need to work on, and that has been a real benefit. And it's also very rewarding, too, to know that you're able to make those kind of impacts just because you're structurally now under one roof. It's real
And
positive.
just mail runs, that type of thing. The mail run. We had, when everybody first moved in the building, everybody had their own mail runner, and we said, well, this doesn't make sense. And it was actually my department that brought it to the attention of the tenant association and said, wait a minute, I just had 3 people come down from CSC within 45 minutes, and so that was something that we brought up, and so we're establishing a schedule so that everybody can do that, so that, I mean, that's staff time with everybody's departments. They don't need to, and I mean, so it's really been little things, but I mean, in the overall big scheme of things, it's they're going to have big impacts, I think.
Absolutely.
Is there anything else?
Anything else?
Thank you very much.
Thank you for your time.
So I just have one announcement. Nancy, I think we're good. Thank you. So I just had one thing. The Wednesday mornings are not good for the sheriff.